Hello. Hi, my name is Kanav Kahol. I'm actually from the Public Health Foundation of India. Thank you, Chairman sir, for letting me speak. I think it's also topical in terms of what we actually are requiring from the POC technologies. So there's a bunch that's actually coming up. I think the technology is there. I want to talk a little bit about public health systems in India and how the public health systems in India are actually going to, and for that matter, even the rest of the world, I think, are going to start utilizing this point of care technology. So I want to maybe not take more than 5 to 10 minutes of your very valuable time in terms of moving this forward. So if you could just move to the next slide. One of the interesting aspects about what's happening in public health is to start looking at where people and their technology adoption is heading. So these are actually figures from the ITU, which is the International Telecommunications Union. It's actually a United Nations organization. And I want you to pay attention to this period of 1994 to 2004. And if you take a look at the percentage of people actually using the internet, what's very fascinating is that almost every country, if you go through Brazil, Russia, India, China, South Africa, Nigeria, United Kingdom, United States, there's a massive increase in that period. Okay? What you actually suddenly see is that people are starting to use technology and people are becoming aware of technology between this period of 1994 to 2004. Almost every country goes through this knee in the graph where the increase suddenly becomes quite massive, and that's true for almost everything. So if we go to the next slide, just the same figure actually for mobile cellular telephone subscriptions per 100 inhabitants, and you see this massive increase in almost every country that is actually out there. So if you just go ahead and actually compare this, look at the fact that in mobile subscription, or rather even in the population using the internet, India actually showed an average growth rate of 303% of the number of people using the internet, and that value and the maximum actually was 2,352%. So what was happening in that period of 1994 to 2004 actually bears special significance to the technology, that people were getting more and more aware of technology. Even though many of us did not have mobile phones, we knew what a mobile phone was. Villages were becoming aware of mobile phones. And this period of 94 to 2004 can almost be called as the zone of capacity creation, which is people knew what technology was and what the benefits of technology was. We were still not necessarily into health, but things were happening. Now the next phase is very interesting, which goes from almost 2004 to 2014, where revenues from the mobile networks are actually going through a knee. So almost all mobile phone companies are making massive amount of money, but they're not making money based on the technology they're selling, because the next graph, if you go to the next slide, what's happening is that the cost of actually technology is coming down, right? So an Apple iPhone 3G in December of 2009 used to cost $199 in US. On October 5th, 2011, it costed $0. Okay? So what was Apple making money off of? Apple was making money off of sharing the revenues of services, right? I don't know if this has been mentioned in this conference, but Tata right now actually offers a doctor on call service, right? 9 rupees a minute, you can actually call up a number from the Tata 3G phones and get to a doctor. Okay? So the services propagation really has been coming in. So if we actually move to the next slide, here's sort of where all of this is actually going in, which is the period from 94 to 2004 was actually the zone of capacity creation. That's when technology was coming in, people were becoming aware of technology, and it was really catching on. Between 2004 to 14 is where the zone of affordability and services propagation is coming in. And already, if you go to the GSA, which is the Global Suppliers Association of Mobile Phones, you can actually go ahead and look at the fact that there are already 130 odd countries where there are commercial health-based services over the phone. 130 countries, that's not a small number, right? They range from anywhere. For example, in Sri Lanka, there's actually a service where you can schedule an emergency, an ambulance over your mobile phone. But what's very interesting is it'll send you, if you're calling in as a patient, it'll actually send you a little SMS that'll tell you that this particular ambulance is arriving. But to the ambulance, it will also send the shortest way to get to that place, right? So these technologies are already out there, and I think it's really brilliant in terms of the fact that the services are starting to be optional. And what we are hypothesizing, and this is a Lancet publication that we just submitted, is that between 2014 to 2024, people are going to start demanding that these technologies actually reach them. Okay? And to put it in perspective, a person born in 1994 is going to graduate from college in 2016. Okay? They're going to be doctors and engineers and everything by 2016. That gives us 5 years to get our act together. 5 years for us to actually ensure that these technologies reach the right person. And it's up to the manufacturers, it's up to the public health systems, it's up to the entrepreneurs to really guarantee that this actually happens. So really, what does this mean? We've actually talked about the right to e-health, and there are essentially 10 odd services that I think that the public health system will require in the very near future. E-scheduling, right? For anybody who's been to a government hospital in India, and I don't know how many of you have ever done that, I actually did that. I showed up as a patient just to record in 5 hospitals in Delhi, and my average wait time was 3 hours and 45 minutes, right? And the maximum was actually 6 hours. The lowest was in Wellington Hospital, which is somewhere in Karol Bagh area in Delhi, and it was just hell, because you first stand in line to get to somewhere where you're supposed to pay 10 rupees, and then you get this little thing, and then you're supposed to stand in line for the doctor. The doctor's in this small little room, and there are 20 people that are already waiting to get to this coveted little steel stool on which somebody sits. And I don't understand where technology will fit into that. Well, it has to, right? So you have to really get this e-scheduling thing figured out. We should be able to send an SMS or call a number to get an appointment, right? Simple as that. E-consultations, it's already happening. I have seen enough technology for the last 7 years to know that e-consultation is not a thing of the future. It's there, we just need to have to happen. But one thing that's very important for everybody here, and I ask this question to every audience I go to, I said, let's say your daughter's sick, 102 fever, doctor's 40 kilometers away. Would you drive, or would you call a phone? Or would you do both? Right? The point that's very important in this question is for you to understand that when the patient is involved, he or she should not get a secondary experience from an e-consultation. Okay? There needs to be a value add. And what that value add is, I have some ideas on. But I think it's important for people to try and think about the fact that right now the way telemedicine is, for all of the stuff that's being done, it's a secondary experience. Okay? And we need to change that. Right to e-analysis, diagnosis, prognosis, and health tips. I think the age of patients actually realizing that doctors don't know everything is coming, right? So clearly there are algorithms and technologies that can actually help make analysis and diagnosis. And people are going to demand that from the system. We know that from the success of certain systems that this is actually possible, and it just needs to happen. I think we've already seen in the couple of presentations the right to e-records and how important e-records are. And e-records really do need to be made very clear. Who owns them is a very important thing, because in India, one of the greatest advantages is that if I have an X-ray, I can walk in with that X-ray to 6 different doctors. It's my choice. And any cloud-based system cannot take that away from me. Okay? So don't take my record and call it yours. It's mine. The privacy and security, which is very important, I think it's a given. You know, we need, even though in India we don't have HIPAA, and HIPAA has become this big giant in US, which is not necessarily allowing for the kind of innovation that's required, we do need to guarantee privacy and security. I know of cases in India where an employer found out that somebody had AIDS and they fired them for no fault of theirs. Then an NGO had to be involved and they had to rehire them. But that stuff really does make very big. E-billing. So mobile billing has really become a big thing. It's already become a big thing in Africa. In India, it's just started. The fact of the matter is that I should have a cashless transfer at my public health systems. And governments, as well as all the technology that government procures, needs to support that. E-enabled drug and device management, there are already systems that allow me to look for counterfeit drugs, right? Nigeria already has one. You've got this number that's printed out on a drug or a pill. You send that number as an SMS to a particular number, and you get back a little SMS saying whether it is legal or not, whether it is counterfeit. So we need that stuff. And devices, I think it's great to hear Dr. Gaur and Dr. Gupta's presentation, because device manufacturers are already thinking about the fact that all of this has to plug into some sort of a cloud-based system where I can use this system. E-information and communication, we cannot just rely on printing health tips on the back of boxes. We have to use mobile phones, right? We have to use SMS services. Now to go that, e-community health, the fact of the matter is social networking is here to stay. It's up to us whether we want to regulate it and use it or just ignore it. And the answer, I think, is very clear. We have to use it. If there are social networks like patientlikeme.com, as well as others that are coming up, we need to provide that particular system thing. And then the e-interventions piece. Diabetes, all the lifestyle disease can be easily managed through this. So this is really what I want to sort of present to this audience, that the time for POCs, technologies, and the time for e-health is right now. Okay, we've got 5, maybe 4, you can argue maybe 6 odd years for us to really get into this. And what the public health system needs is technologies around this space. So that's the end of my presentation. And as I said, just take this as something that I hope everybody works towards, and we can actually literally marshal our resources towards doing. Thank you.